Welcome to today's webinar entitled Partnering with a Purpose. This webinar is being made available through a collaboration of the Florida Department of Children and Families, Office of Substance Abuse and Mental Health, and the Florida Alcohol and Drug Abuse Association. Please note that as an attendee, you are in listen-only mode and will only be able to view your name and the host. If you have questions, please send them to the presenter and me, the host, by using the chat panel. The button to open the panel is usually located in the lower right side of your monitor. Please use the chat panel to send any questions you may have as you think of them. The presenter will address questions as time permits. Our audio is broadcast through the internet to your computer. If you experience poor computer audio, there are a few options to try on screen right now, and these options will be posted in the chat panel. If you continue to experience poor audio through your computer, try rejoining the webinar and use the I will call in telephone option. You must be connected to the audio of this presentation and view it on screen to receive a certificate of attendance. And materials used in today's presentation will be available on FATA's website within 30 business days. To access the recording and PowerPoint, go to www.fata.org, then to our Resource Center and onto our training library. FATA produces many webinars and workshops through the support of the Florida Department of Children and Families. To help participants track credits earned through attendance, we host an online community that provides a personalized digital journal where participants can maintain statements of credits for webinars and workshops taken through the Florida Alcohol and Drug Abuse Association. At the end of today's webinar, the web browser will direct everyone to an evaluation form on FATA's website. You will first need to register or sign in to complete the evaluation. Information you provide FATA as a part of registering remains confidential. Statements of credit will be posted 30 business days after the evaluation closes for persons completing the evaluation and attending the full webinar. Completing the evaluation is necessary to receive CE credit or to access your statement of credit. Please note that the evaluation will close midnight Monday, January 23rd. Up to 2 continuing education credits are available for participating in today's webinar for persons licensed through the Board of Nursing, the Board of Clinical Social Work, Marriage and Family Therapy, and Mental Health Counseling, and for persons credentialed through the Florida Certification Board. If you're a licensed healthcare practitioner, you needed to include your Florida license numbers for reporting to CE Broker when you registered for this webinar. If you are certified with the Florida Certification Board or licensed outside of the state of Florida, you do not need to provide a certification number when you register with our site. Please note that WebEx monitors arrivals and departures of attendees and provides a report upon completion of the event. We are not permitted to provide a certificate of attendance if you do not attend the entire webinar, and we are not permitted to provide partial CE credit. Ashley Gonsler leads a specialty coordinated care team comprised of clinicians, prescribers, peer mentors, education, and employment specialists who collaborate to support transition-age youth at Threshold's Emerging Adult Division in Chicago, Illinois. In this role, she engages in prevention work, crisis intervention, and uses a strength-based approach to help youth, young adults, and their families with identifying tangible ways to break generational cycles and begin to create sustainable, healthy, and adaptive patterns. A graduate of Michigan State University, Ashley holds advanced training in cognitive behavioral therapy for psychosis, a best practice for treating individuals experiencing their first episode of psychosis, and is trained in structured interview and psychosis risk syndromes to detect individuals at clinically high risk of developing psychosis. At CHR Team Leader, she is committed to identifying and providing prevention treatment to individuals most at risk developing serious mental illness. And now I'd like to welcome our presenter, Ashley Gonsler. I will turn the presentation over to you.
Thank you so much, Rebecca. Thanks for the introduction. I'm so happy to be here and providing this presentation today. So as Rebecca said, my name is Ashley Gonsler. And I currently reside in Chicago, Illinois, but I know a lot of you are probably joining in from Florida or maybe some other locations. So to help me feel less alone in this and know that everyone's tuning in, how about everyone take a moment and let me know what city you are currently in, logging into for this webinar in the chat box, and you can add something about either the weather or something you've done so far this morning. So again, I'm logging in from Chicago. The weather is not great. It's like 37, and I think it's supposed to rain later, so I'm not looking forward to that. But something I've done so far this morning is had a cup of coffee, and that usually helps me get my day off to a good start. So feel free to sign in the chat. Let me know where you're coming from and either the weather or something you've done today. Looks like we have Naples, Florida in the house, St. Petersburg. Warm and sunny. Man, I really should consider moving to Florida, I swear. Oh, we've got a Texan here who's also dealing with some rain, and got Pensacola, Florida, Melbourne, Florida. Great, keep it coming. As I put up my next slide, I want to tell you all a little bit about what I'm doing currently in my role, but also what brings me here and my background in community mental health. So I originally reside from Michigan, and that's where my first work with community mental health came from. So when I was in Michigan, I had the opportunity to work in a rural part of Michigan with not a lot of resources and in a program that essentially functioned as a coalition. Um, they wanted me to go out in the community and explain this new program. It was called Healthy Minds, and it was a Medicaid expansion program aimed at providing outpatient services to more community members. So individuals who maybe wouldn't need a high level of care or be at risk of hospitalization, but who were otherwise unable to utilize resources such as outpatient therapy and get support that way. So at that time, for me, partnering felt like the great unknown, kind of awkward and uncomfortable. One might say kind of like high school, like, what am I doing here? How is this supposed to go? I have some idea, but not a whole lot of what's actually going on. So part of this presentation today is zoning into that part so I can share my own experiences, both the good, bad, and ugly, and the research behind why it's important to partner. So after Michigan, decided to come here to Chicago for more opportunities. I worked with Threshold's MindStrong program. So it's a multi-step care program that utilizes a multidisciplinary team and evidence-informed approach to both identify and treat young people at risk for serious mental health challenges or emerging psychosis syndromes. Early assessment and services are key in the return of young people to healthy and fulfilling life. So in this role as well, being first episode, a new program, I had to learn how to partner with the stakeholders, being the individuals, their support people and family members and community members, so they also were aware of this program and what resources were available to individuals who fit this category. So again, new city, going out there, trying to communicate this wonderful program that had a lot to offer. It took a lot of partnering and understanding about how to approach it and how you can communicate with people so that there's this shared understanding of what could be helpful for someone, or if not in that scenario, store it for later. So after that role, I ended up coming to a hospital setting, and I do outpatient behavioral health treatment for individuals, a wide range, as young as 17. I think my oldest is just over 70. But being able to provide a comprehensive approach to therapy and case management to help individuals be able to navigate their life in the way that they feel like is most helpful and fulfilling. But again, partnership plays a role in this position as well. I work in a hospital setting. Most of my clients that I see have a primary care physician who's also in the hospital setting, and or a psychiatrist or a case manager or different counselors too, whether for family therapy, couples therapy. Partnering comes up as an opportunity in so many different roles. And so I hope that with this presentation, it gets you thinking about what are the current partnerships you are a part of, Or are there other opportunities that are right in front of you that you could utilize and connect with, because partnering is so important. All right, so I see that we've got lots of Florida check-ins, and we got Palm Coast, and wow, 60 degrees and sunny. That would be a giant heat wave for Chicago. So I'm a little jealous of that, but I appreciate you all logging in. See, if I moved to Florida and it was 60 degrees right now, it'd be really hard to be inside, but because it's like 30s and rainy, it's okay to be inside. So glad you all are waking up with me, getting your coffee, get water. Feel free to take a break as needed. We'll probably just go right through the PowerPoint and try to end early. But take care of yourself. So if you need to step away, feel free, but also try to be mindful of turning off the work distractions and not feeling that urge to respond to work emails or texts, and allow yourself just to be present for these next almost 2 hours. All right, here's the disclaimer. The views, opinions, and content expressed in this presentation are those of the presenter, so myself, and do not necessarily reflect the views, opinions, or policies of the Florida Department of Children and Families. There are no actual or potential conflicts of interest to disclose. This presentation was created without any commercial support. Basically saying if I say something too outlandish, you can't blame them for it because it's my fault, but we shouldn't have any issues with that today. All right, so you're here today because maybe you needed a training to attend to break up your workday. Maybe you're in need of CEUs. My theory is something about the work you do and your passions aligned with the description of this training. So the objectives are listed up here on the screen. They include the intentions behind this training, and I hope each person feels that they are met at the end of our time together today. To reiterate why I'm here and why you're likely here, I'd like to read the description for this training. So to enhance substance use prevention services, a great emphasis is placed on identifying ways to connect and collaborate with each entity involved. Partnering can be established within the context of increasing caregiver and natural support engagement, community organizations, schools, correctional, and healthcare systems. It can also encompass the collaborative relationship between service users, caregivers, youth centers, community agencies, or organizations. Partnering with a purpose allows for a higher likelihood of effective substance use prevention interventions. There's resources that will be available on the resource page, and if there's time, I'll kind of give you an overview of what some of them have to offer. But again, try to be present. Know that you can always look back on this PowerPoint, send in your questions as they come up, or if you have questions that arise after our time together today, you're always welcome to reach out to me via email. So let's get started. Community engagement brings together the skills, knowledge, and experiences of diverse groups to create and/or implement solutions that will work for all members of the community. This is why it's important to partner. When we work in isolation, we miss a lot of key information, such as what works, what doesn't work, and we do not allow for additional perspectives. When we open ourselves, whether it is an individual provider or an agency or a larger entity, we create space to join forces and develop effective strategies for our shared purposes. So again, think about this. If we're doing something in isolation and honed in on the one thing we are focused on, we're not able to see what's going on around us, or to see what other people are doing, or to allow someone else to provide insight or perspective on what it is that we're working on. I'm curious, just with me sharing my background of different positions and ways in which partnering had come up, where you all are coming from, and if you already have some places in mind of who you partner with the most for your job, or even outside of your job, maybe in your personal life. Maybe you have a child and you partner with their school a lot to collaborate and make sure things are getting done and they're able to get what they need to out of the class and get that support. Does it feel like you partner well with a healthcare provider? Who is it that you feel like you partner with, either in your personal life or in your job and your role? Go ahead and throw some answers in the chat just so I get a sense if anyone is willing to share just which entity or agency they tend to partner with, again, whether in your personal or professional life. We have a few answers coming in. So a countywide school district, the community has a variety of resources at our disposal. That's wonderful. We also have mobile crisis response team, most outpatient service providers, local court system. I worked a lot with the court system at the job in Michigan that I referenced. A lot of individuals on probation or parole, also individuals who had child welfare involved as well. Local health department and sheriff's office, private practice, partnering 4 states, and a lot of criminal justice issues. Yeah, that seems to be a common connection, which also can be tricky depending on background and kind of approaches to care. Sometimes different entities tend to butt heads on how they philosophically view situations, and so it takes a fine dance to try to collaborate enough so that we feel like we can partner productively as well. DCF and other community partners. We have Sydney, who works in the behavioral health unit of a law enforcement agency, and they partner with the Department of Health and Fire Rescue. Okay. Someone else working with an EAP, mobile crisis, local homeless shelters, and countywide medical providers. This is wonderful. School district, law enforcement, healthcare providers, substance use treatment providers, Department of Children and Families. Wonderful. You all have a wealth of experience. So again, too, this is not just me sharing that I know everything about this, but I'm giving my own background experience and research. But please feel free to jump in if you have different insights or perspectives, because again, this is partnering, this is collaborating. So thank you all for sharing those. We're going to go ahead and watch a brief video, and then we'll come back together. Okay. So with that video, what I like about it is it talks about community being part of like a sense of belonging. And we're talking about community engagement. It's individuals within um, a close geographic proximity or with special interest in what's going on coming together to address an issue. And it's very active, it's not passive. Another highlight too from that video is it's a more efficient use of resources. So we'll get into what that looks like and how that plays out, but just to bring some attention to key points from that video. So community engagement is a process of developing relationships that enables stakeholders to work together to address health-related issues and promote well-being to achieve positive health impact and outcomes. By building community trust and relationships, community engagement may benefit substance use prevention by promoting implementation of evidence-based practices, selecting evidence-based practices to meet community needs and adapting them, because we have to be willing to make those adjustments as needed, and increasing the sustainability of evidence-based practices. So it's not just, oh, we have some money, let's go ahead and throw this program in. We want to make sure we're gathering information about the community in which we are intending to implement these evidence-based practices, being willing and able to make those adjustments, and then ensuring that it's a sustainable practice. So a priority for SAMHSA is ensuring that behavioral health services reach under-resourced populations for prevention, treatment, and recovery supports. Implementation of evidence-based practices, policies, and programs can reduce mental health and substance use problems for individuals and communities. However, implementation and uptake of evidence-based practices can be challenging, and only a small percentage of communities have implemented them. Even when communities implement evidence-based practices, not all populations experience their benefits equally, including those in greatest need. Health disparities may worsen as a result, despite the goal of equity. Prevention researchers have identified community engagement as a critical factor that influences the equitable scale up of evidence-based practices and subsequently contributes to improvements in population health. So here's where I want you all to tune in again. Again, just respond in the chat and I'll do my best to read as many responses as possible. But I want you all to reflect on what you would identify as a potential barrier or challenge to community engagement. What do you think may make it difficult or get in the way of being able to reach these goals of getting community involved and engaged in order to work towards a shared goal? All right, thank you all for responding. Please keep them coming in. So we have insurance and finance, definitely. Bed availability. We have another response of funding. Money is definitely an important resource that is necessary. No collaboration. Yeah, we could be trying to get the community engaged, but they're not reciprocating. We're not able to collaborate with them. Another person said limited funding. We also have distance. There's one large county with transportation issues. Yeah, people could want to be engaged, but if there's like a town hall meeting or let's all collaborate and work together on certain things, and people aren't able to get there, that's an issue. We also have people feeling like you are the competition. I'll mention this later, but yeah, it's like kind of the stance of, well, I know what's best, or I want to be able to provide these services and not lose that, because sometimes in order for us to get funding, we have to meet certain benchmarks. And so we need to be mindful of that and how we partner and why we partner, but also the overarching goals we have. We also have funding again, insurance definitely. I'm sure a lot of us could talk about insurance challenges all day, but we won't do that, don't worry. Overwhelmed practitioners and not able to collaborate. Yeah, people work hard and it's tough work and it's exhausting. And so at the end of the day, sometimes we feel like we don't have it in us to do that extra or reach out to another person or go back and forth in communication. Another great answer is varying cultural norms and longstanding habits. We have transportation again, or other family responsibilities, so child or elder care. Um, Time resources, lack of communication. Yeah, that definitely can cause frustration, just make us want to give up. The community may not be aware of the severity of the issue, differing beliefs, and homelessness. All great answers there. So I like this picture because they're all putting their heads together, and that's what I think of as partnering. So with my own background and experience with community engagement and also managing others' expectations, um, engagement can lead to collaboration and shared understanding. But what we want to avoid is what some of you brought up in the chat, is that conflict around how something should go. Sometimes we think we might know best, or we might be protective of the populations that we serve. We may be hesitant to relinquish a sense of control over our programs or services because we don't want to have anything get disrupted from the great work we're doing. And another thing too, we might also have a personal stake in the matter, right? All of this is valid. However, when it comes to partnering, being open and flexible and willing to take a step back and decide how we can move forward and be effective is so crucial, because otherwise we're working in isolation and we're not able to see the bigger picture and gain differing perspectives. We have a few more answers. We have language barrier, and getting an ID has been an issue for unhoused individuals who need services but can't get services due to those barriers. Absolutely. Okay. So implementing evidence-based policies, environmental strategies, and programs requires an understanding of a community's challenges and knowing which strategies will effectively address a community's specific challenge. By engaging community members, prevention systems learn firsthand from affected individuals and community systems about substance use problems and the social determinants that affect behavioral health. Within the prevention systems, community engagement often consists of engaging community members with needs assessments and prevention planning, building community capacity, selecting and implementing evidence-based practices, and then again, evaluating those evidence-based practices for their effectiveness over time, and more of that sustainability. And do they continue to meet the needs that we initially intended them to? Community engagement within prevention systems integrates meaningful participation of community members. So again, meaningful, we're trying to bring people in to get their voices heard and also have that be part of our plan, not just have people come in, express their needs and their perspective, and then not take that into consideration and integrate that into our plan moving forward. So community members who have their own diverse experiences values, cultures, and perspectives. Community engagement also ensures accountability to those most affected by problems related to substance use. So if we're going to bring people in the community to participate, we need to be willing and able to hear their perspectives, but also allows it so that they can be an active component in implementing different programming and services that they can also participate in. Developing an effective community-based prevention strategy to address substance use depends on both assessment and engagement at the community level. It requires community voice concerning how substance use affects individuals, families, neighborhoods, and community sectors, so child welfare, healthcare, and law enforcement. Assessment of historical trauma and neighborhood level risk and protective factors for substance use, as well as other social determinants of health. And then lastly, capacity building to enable substance use disorder prevention systems, partner organizations, prevention professionals, and others to deliver evidence-based practices successfully. Collaboration among community partners to identify evidence-based practices that can effectively address problems the community experiences, implementation and evaluation of evidence-based practices to measure improvements in community conditions and behavioral health, an assessment of the community engagement process to ensure it is equitable, meaningful, and continual. So even in this regard, I think about when I mentioned my role in rural Michigan, trying to be the one to jumpstart a program that was part of the Medicaid expansion in order to provide more access to individuals for different mental health services, in particular outpatient therapy. In reading some of these community-based prevention strategies, looking back on that time, I know there are areas where I certainly missed the mark. In my experience, I went out and tried to make connections with different community stakeholders. A lot of that included healthcare providers, so primary care physicians, also church members, different community agencies, but it was really challenging in order to get people who would then be service users to participate in this planning of how to implement services. There was not a lot of trust within the community. It's important to note too that the building which I practiced out of was part of the community mental health organization I worked for, but it was in, what was it called? A government complex is what it was called, which also housed, get ready for this, y'all, it housed the child welfare program, so similar to like DCF, and it housed law enforcement, and it housed both the county jail and the youth center, which is where people under 18 would go if they had done different things or had truancy with schools. So again, I was operating out of a system within this complex where people had a lot of reasons to not feel safe and comfortable seeking out help and support when you look around the corner and there's county jail, or there's your PO, or there's your caseworker for your child welfare case. Like, there wasn't a lot of trust there. In addition to individuals who may have been undocumented, right? So it was really hard to go ahead and sell this idea of, come here, we can talk about things in therapy and I can support you, but you have to come into this government complex and see all these other entities surrounding me and think that this is a safe space to disclose some really difficult things, and especially in particular to any substance use, there'd be a lot of fear of, well, if I tell you I'm doing these things, what are you going to do? Are you going to turn me in, or what's going to happen, right? So again, I think there was missteps of like how to implement service users in that approach, but also like the environment is so vastly important, because when we're talking about different community history or trauma, there's a lot of things that play into that, and mine was very obvious, but some of those are less obvious, and so being mindful of what those things are and how individuals may interpret them. Here we're talking about obtaining feedback from community members to ensure that the outcomes from these evidence-based practices are consistent with community priorities, expectations, and lived experiences. So this one, I also think about anyone who does any sort of direct service providing. So I provide therapy. One of these things I think of is like, if you're in the role of a therapist and you're meeting with a client, you're saying, hey, I feel like you've made a whole lot of progress. Look at where you're at, and this is what's going on. You're sharing your observations, but that might not match up with the individual's own experiences and feelings about the situation. So as much as it's great to be like, yeah, I see you're doing this, or you stayed out of the hospital and you haven't relapsed, or you're attending your groups or your meetings this amount of frequency, but if the individual does not feel like that's progress or those are things important to them, then at the end of the day, it doesn't matter. It needs to be what's important to community members as we're partnering, and being able to take those into account and consideration, so we're aligning with what it is that is the expectation and priority there. So again, the trust part. So community engagement begins by gathering the community or assembling a group of people, community members. Relationships and the trust upon which they are built needs to be in place. Authentic community engagement efforts recognize that there may be distrust within the community. Another note of that job I've been referencing, as if working within a governmental complex wasn't challenging enough, there were generational stories about individuals seeking support or services who had their own experiences with seeking out support or treatment, or working with a provider while they were on probation or parole, and so they had their own basis of how they formed their thoughts about whether or not receiving services could be helpful. The process of establishing trust starts with dispelling myths and honestly acknowledging community members' shared traumatic history, structural racism that perpetuates inequities, and other trauma experienced by communities, including the LGBTQIA community. These definitions on the PowerPoint are as follows. So structural racism is a system in which public policies, institutional practices, cultural representations, and other norms work in various, often reinforcing ways to perpetuate racial group inequality. It remains a root cause of the persistent health disparities in the United States. Historical trauma is collective, multi-generational trauma experienced over time by a group of people who share an identity, affiliation, or circumstance. It is frequently linked to health disparities. When this distrust exists, communities need to promote healing and reconciliation so that meaningful, trusting relationships can develop. This process involves actively seeking information, visualizing what needs to change, and engaging in shared learning. Formally acknowledging a community's shared traumatic history is a fundamental step in preparing for and planning community engagement efforts that address health inequities. Okay, so next we're going to go into the core components of community engagement. We're talking about trust a lot, and I know we all know this is important, right? Because when we think about partnering again in our own personal life or professional life, if we don't trust the other person or entity we're collaborating with, it's going to make it really tricky for us to buy in and allow for that process to happen, or meeting each other in the middle. So with community engagement, it creates an environment in which all ideas are respected and considered, right? So if we think about, like, if you ever been in a group setting, like either socially or within school or work, where everyone's allowed to kind of like give their opinion or speak their mind, and it always feels like there's a few people who maybe say things and you're like, wait, what? How does that apply? Or what does that mean? Even those opinions are respected and considered, even if they're not the ones we go with. That's the individual's own understanding and experience, and it's important to acknowledge that and not immediately shut down those opinions, right? Because the whole idea is getting people to collaborate and participate in this. So all ideas are respected and considered. Discussions and input of participants are documented and shared. And there is a mutual understanding of stakeholders and community members' needs, capacities, and goals. So being able to document people's opinions, share it with everyone, and having an understanding of what we're working with, what are the needs, and what are the goals and things we want to head towards. Next is careful planning and preparation. So community engagement is a strategic process of planning around an issue of interest. So those involved continually reflect on the best ways to engage community members, stakeholders, and the needs of participants. Then we'll go on to inclusion and demographic diversity. So community engagement involves leaders from different sectors of the community, as well as community members at large. Individuals and sectors participating in community engagement represent the community's diversity and brings various perspectives and expertise. Collaboration and a shared purpose. So community engagement brings organizations and individuals together around a shared purpose, such as prevention of substance use. If there's no shared purpose, there's not a whole lot we're working towards together, right? So community engagement involves shared decision-making and equity among participants. Next is openness and learning. I know I mentioned that in one of the earlier slides, like how openness and flexibility is important in order to have this collaborative process. So participants in the community engagement process are open to data, information, and ideas from all relevant sources. They listen to others' views and experiences to develop an informed, data-driven plan for addressing community issues. For impact and action, that's where community engagement focuses on making a difference in the community and having an impact on the identified problem. Community engagement is intended to move communities towards desired outcomes. And then lastly here is sustained engagement in participatory culture. So community engagement is ongoing. All participants are valued for their contributions. Information and resources are shared among community members and stakeholders to advance outcomes and build community capacity. So we're not learning about something and keeping it hidden or secret for ourselves or for our agency. We have to be willing to have this culture in which everyone's being able to participate and being able to share resources and information as part of this shared purpose. Without that, we are self-seeking, whether, to try to maintain a certain amount of flow with our work or in order to try to have the best approach. Those are not things that are conducive to partnering. And so that's very much important to be mindful of. So this next slide, we're going to go ahead and watch a video. And for the video, like I did with the first one, where I brought out some of the main themes or messaging, I want you all to pay attention to that. Throw some things in the chat. You can do it as the video plays. All right, what did you all think of that video? What stood out to you? What did you like, or what did you feel like was important in the messaging for the video of the role of the community when it comes to prevention, other than the fun illustrations and showing the different city life? What stood out? What were things that felt helpful from the video, or even if there was something that felt like it should have been included? All right. Thank you all for participating. I'm going to go ahead and read some of these responses. All right. We have collaboration is critical to life-saving ventures. Absolutely. Absolutely. That's great. Someone else liked that prevention could save big money. Definitely. I know we all talk about and probably joke about, but are not joking about the struggles with insurance, right? And insurance companies. and how important prevention is for saving money. So even if it's difficult to want to give money towards different programming or services, insurance companies can actually benefit from saved money if we're able to get ahead of some of these concerns from developing. If we're able to prevent, there's not a medical necessity for these higher level of care, whether it's like a psychiatric hospitalization or a treatment facility for individuals. Someone else noted that great highlighting the risk factors and how they are counterbalanced by protective factors. Absolutely. I think that's key for prevention when we're talking about substance use, mental health. And this comes up to mind too when I think about safety factors, right? Um, with any like risk of harm to self or others, like there are risk factors involved, but it's also important for us to identify what are those protective factors that will keep individuals from acting because of those risk factors. We also have the integration of all the partners. This is very crucial. It's important to offer activities in the community to prevent substance use, definitely. And we talk about community meaning a sense of belonging and creating positive attachments and associations to things that people can engage in. They have places to go and things to do outside of using. We also have providing tools and empowering people to make healthier life choices, definitely. Um, we also have someone who liked the line that prevention saves lives and the idea that prevention betters the community as a whole. Yeah, think about it this way. Like, if we're focusing on prevention as a way to treat individuals who live within a community and the community has buy-in, people aren't going to want to leave that community. It's not going to be blacklisted on the places of where you shouldn't live. People are going to understand that in that community there is that belonging, um, and that shared purpose that helps you feel comfortable navigating, right? Some of our challenges that we have or risk factors that may still be present. All right, let me read just a few more. So the biggest role of the community is to participate in joint efforts towards prevention. This is critical to addressing any broad concerns such as mental health and substance use. Definitely agree with that. Great response there. An individual with substance use concerns feeling supported by the community and the prevention of further substance use among young people, definitely. Someone else mentioned the risk versus protective factors as well. Um, Everything was in close proximity, the buildings, hospital, library, and school. Yeah, that's a great observation too, right? Someone else earlier mentioned how transportation can be a barrier for community engagement. And I think of the proximity of things, like you said in this video, how important it is to be able to have access to resources in which individuals can utilize without that concern of something being way across town or outside of reach for them. Um, and then the last comment, I really like this one too. So it cannot be done alone. It truly takes a community to work on the problem together and provide a united system. Thank you for that. Okay, so we're talking a lot about community, right? So like who's included in community, right? We're talking about youth here, which is highlighted in the video, but also parents and family members. I think both ones that are chosen and given to us, right? Because sometimes we choose who our family or support people are. People in recovery, and businesses. So this can be any business, barbershop, salon, gym, um, media, schools, and other educational institutions, which I know a lot of you mentioned are part of the community entities that you already collaborate with, youth serving organizations, and public safety and law enforcement. Um, Keep this in mind. In a few slides, I'm going to ask which entity or community member might be most challenging to partner with, and this is from your own perspective or experience, but like take a mental screenshot of this slide, or I can always come back to it, but it'll be in a few slides. So, all right, so who's included in community? So this can also include faith-based organizations, fraternal organizations. I had an idea of like what this meant, but I also looked into the definition and got some examples. So if anyone else is feeling like, who does that exactly include? I'll let you know. So fraternal organizations are brotherhood or type of social organization who members freely associate for a mutually beneficial purpose, such as either like a social thing, professional, or honorary principles. The term fraternal organization stems from a Latin word meaning brother, and it's more of like a social club or membership organization formed around a common bond, ideology, or personal background. So this can range from college fraternities to professional organizations and trade units, or like civic clubs that provide that like deep networking for members, in addition to the social activities, leadership training, and continuing education. They're often granted preferential tax treatment as a 501c and can provide certain benefits to members, such as discounted like life or health insurance. So the biggest one I thought of, and that was listed as Knights of Columbus, Fraternal Order of Police, Veterans of Foreign Wars, and American Legion. So that's fraternal organizations. Next is civic and volunteer organizations, healthcare, so pharmacists, dentists, physicians, nurses, prescribers, veterinarians, state, local, and tribal governments, and other organizations involved in reducing substance use are all included in community. So again, it's a pretty wide range of who can be included. So when I told you to keep in mind the list of who's included in community, this is why. So please go ahead and type your response in the chat about which entity, agency, or community member do you personally or within your role in your agency find most challenging to partner with. Go ahead and take a moment, respond in the chat. I'll read some of the responses because I'm sure a lot of these will overlap with each other. As we do that, I also see another comment here from Kelly. Thanks for sharing this. Kelly said, I've started telling our inmates in the jail substance abuse program that we want them back in our community with jobs, in school, and with their families. It's made a big difference. Those are protective factors, but they are literally shocked that they aren't going to be shunned for the rest of their lives. Yeah, it's almost like when an individual goes through a certain system or is involved in something, it feels like they're kind of marked forever, right? Or they feel stigmatized by it. But the part about community, it's like people actively contributing to that, whether it's job or school or being back for your family or your kid, those are all things that are important that help communities to function better. It is so, so, so important. All right, so most challenging, we have school systems, medical professionals, the court system, judges. Yep. Fun fact is my first internship was working within a court system it was a program called Intensive Neglect Services, where kids would either be in the process of being returned home from time in care, or they were at risk of being removed from their home. And so it was pretty heavy duty services to try to either prevent it from happening, like the removal of the kids from their home, or to try to get them back integrated safely into their home. Let me see what else. Central Florida Behavioral Health Network, so our managing entity for funding. 12-step fellowship inclusion, local jail, people in recovery and law enforcement. Health related, many doctors are very cautious and underinformed about substance recovery. Yeah, kind of that stamp of judgment can keep people from wanting to kind of get the full picture. I think that also can be very true with certain diagnoses as well. If it's documented in their chart and then they go see someone, they might have certain um, like prejudgments about an individual when they're treating them. Those that are not flexible with the insurance plans they accept, yeah, making it really difficult to seek out services that could be helpful, right? If there's limited options and there's long wait list, then it feels really defeating just waiting and waiting to do something that already feels pretty challenging or vulnerable. I think that's definitely a major challenge. Treatment centers is another one. Parents and family members. I'd be curious for the treatment centers, what type of treatment centers? I remember also another internship of working in a residential facility, and there was a lot of clash between the direct care staff and clinical staff about framework and approach to treatment and management of behaviors. And I noticed that was something that came up very consistently in team meetings about what should or shouldn't happen with a specific child, or what certain things should be enforced or met with like a punitive approach, as opposed to more trauma informed and trying to understand the behavior and why that individual maybe struggled to do certain activities. Other agencies that provide some of the same services that we do, reaching out to them is sometimes looked as competition instead of collaboration. Absolutely. I think that's where trust kind of plays a big role too, right? If we're like calling over to another agency and saying, hey, what are you doing about this issue? Or what's your approach to that? They may be reluctant to share that information, thinking you're trying to get one over on us, right? And get this information. But like, I don't want to share it because that might screw us over, right? So like that trust is important. And I think also too, having that shared purpose and interest that you're working towards together. Another few people said school systems can often seem closed off as their own system and can be resistant to involvement from other systems. Okay. Got another insurance companies, private hospitals due to HIPAA, DCFS workers, vast parent opinions, beliefs, and professionals from one end of a 60-mile county to the other one. Yeah, differing opinions and beliefs is definitely a struggle, certainly. Extended family, many psychiatrists locally not accepting insurance, right? Yeah, right. So we're looking at all of the challenges to partner with, right? As a way to bring this awareness to where do we face these challenges, and also being able to take a step back and understand why is that a challenge? Is it a difference in beliefs about how to approach the situation? And if it is, how do we come together in our shared outcome or our goals so that we can better work together for the outcome that we're looking for? So to realize our goal of preventing individuals, families, and communities across the United States from experiencing the unnecessary harm and cost of behavioral health disorders, we must do a better job of addressing the challenges that prevent the behavioral health system from realizing its full potential. So this quote here is, between what we know about how to prevent these problems and what we do to prevent these problems as lethal to Americans. Like, this is a very important issue and something that is important for us to work on and to mend this gap. Of note, we also want to recognize that and reinforce strides, specifically in Florida, that have been made with decreasing trends of youth substance use in particular, um, with success, but also limited resources for infrastructure, expanding prevention programs, and increasing marketing resources through Florida. When we're talking about these things, it's always like there's a lot of areas to focus on and grow in, but I also think it's important to give attention to what it is that we are doing well and where we have made progress. What we know is there continues to be death and disease in the United States due to behavioral health disorders such as depression and substance use. Challenges with effective prevention programs scaling up to reach more Americans. So again, if we have an evidence-based program that we're implementing at one agency and it's working really well and effective, and we want to be able to apply it more places, we got to figure out how to scale that up so it can continue to be effective and sustainable within the community. Next, we're going to look at some challenges that may kind of come across in this prevention work and partnering work that we're doing, and also some suggested recommendations as well. So bear with me for a second. I need to stay hydrated because it's a lot of talking. Okay. So first off, one of the identified challenges is the lack of prevention services funding. So SAMHSA reports that spending for prevention services has decreased from, let's see, 580 million in 1999 to 550 million in 2014. So again, I know we're 2023, but if we're looking at the difference between 1999 and 2014, we're talking about that's 30 million less in funding. And this decrease is exacerbated by inflation, especially right now. Spending for treatment has remained fairly steady and in some cases increased. This imbalance must be addressed. So again, prevention is important because it can save money and it can save lives, right? So we maybe wouldn't have to spend as much money on the treatment services portion if we're able to prevent things from escalating to a point of needing those. So here's the recommendation. Support policies that require more equitable funding for effective prevention. The two major federal block grants for substance use prevention and mental health currently prioritize treatment over prevention. However, if we direct more resources toward effective prevention programs, fewer individuals will need the much costlier treatment services. With slight modifications to existing regulations for federal block and discrepanatory grants, we can leverage the funds necessary to make this happen. I think about this as my job with the first episode of psychosis program. Sometimes we would meet with people 2-3 times a week, just with one provider, but also if there was like an education support specialist or psychiatrist, that might also be part of their treatment plan. And that feels like a lot. And I know insurance companies felt like that was a lot too, but if we're able to meet their needs by increasing those sort of appointments, that could prevent a crisis from forming, which could lead to a very costly hospitalization. So overall, that would kind of play out. Okay, second challenge identified is gaps in local prevention infrastructure. So many local communities lack the training, technical assistance, and organizational support needed to effectively deliver and sustain high-quality substance use prevention and mental health promotion programs. So the recommendation here is to partner with organizations that can provide implementation support to providers delivering local prevention services. So this training, technical assistance, and monitoring are often the first services to be cut from budgets in order to dedicate more funds to direct services. But if direct services are not well implemented, they're worthless. Fortunately, an emerging sector of organizations specializes in providing training, technical assistance, and organizational support needed to effectively deliver and sustain effective prevention programs. So I know in implementing first episode psychosis program, and it being a very new at that time, and not everyone was doing it, there was a lot of training involved and technical assistance and having to check in with different entities to ensure the fidelity of the models that we were using. And I remember that being really helpful to ensure that as we go along, we're checking in and ensuring that we're taking the steps needed, as opposed to continuing the thing as like the programming as is without checking in, and then later come to find out, ooh, we were doing it wrong. That would have been pretty disheartening and frustrating. All right, the last one for the challenge and recommendations we're going to talk about today is the challenge is limited understanding of the value of prevention. By its very nature, successful prevention yields results that can seem invisible. Preventing a person from experiencing a problem that has yet to occur is often overshadowed by the emotional appeal of helping or treating a person who already has a very noticeable problem, even if in the long term, many more people would be helped by prevention. So outside of this, if we can think about other examples, something that comes to mind is that heartbreaking commercial with that sad song that plays and it shows dogs in really bad shape or in shelters. I think about how that's utilized, right, to capture an emotional response to sending money and treating, right, the issues and providing care for those pets who are severely abused and neglected. But there's also an importance to provide that sort of funding and to prioritize prevention, such as free or low cost, like spay or neuter clinics, and being able to provide different health for animals so that they don't end up in those bad situations or there's not as many in those shelter settings. So in the same way, we can look at prevention as being something that's important, but it's harder when it's not in your face and bringing that draw of that emotional appeal or that image that's so hard to ignore. All right, back to it. So the recommendation here is to support state and national information campaigns that illustrate the power of prevention. So in most cases, successful scaling up of evidence-based programs has been driven by external forces that create increased demand for them. We need strategic marketing campaigns like those that effectively shifted public views about smoking to generate public support and advocacy for the widespread scale up of effective substance use prevention and mental health promotion programs. So again, imaging, things that are going to capture people's attention and bring awareness to why prevention is important. I'm not a big fan of reading directly off the screen, but I really like this quote, so I'm going to. So partnering with community members to implement interventions and collect data redistributes power and responsibilities traditionally held by government, academics, and health professionals. It also empowers and builds the capacity of community members to measure and interpret an intervention's effects on community well-being and health. So one of the main, let's say, like messaging or driving forces behind the work I did in the first episode psychosis program was when you're working with young people who also recently experienced a major life change, right? They either ended up in the hospital or had an experience of psychosis, so feeling detached from reality. There's a lot going on there that can feel really overwhelming and disempowering. And one of the main messaging was to do with, not do for. And with this quote, focusing on different entities that typically hold the power, hold the responsibility, I think about this as a way, like partnering as a way to relinquish that control and give the power back within the community. It takes more off of the plates of the providers, and it has that community buy-in to create this long-standing, sustainable impact of communities taking care of themselves and helping individuals in the community who may be struggling, right? Because it's easier to hear it from your neighbor versus maybe someone from law enforcement or someone sitting in office who you see for 50 some minutes each week. So it's really important to think about when we're talking about partnering, we're trying to improve and make people's lives easier, better communities, and also in the long run, be able to take some things off our plates and to be able to give that power back to people, which they deserve to have that autonomy over their decisions and feel that sense of like both accountability and pride within their community. Something to think about. Next, we're talking about SAMHSA's strategic prevention framework. It supports engagement of prevention professionals and community stakeholders in a data-driven assessment process that provides a comprehensive approach to understanding and addressing substance use and related problems that states and communities face. Some of this framework will be kind of, well, assessment, capacity planning, implementation, and evaluation. We'll talk a little bit further about that, but I was encouraged to also mention that in February, both FATA and DCF will have a presentation. It's an additional strategic prevention framework training, and it's entitled Selecting the Right Prevention Approach for Your Target Population. So something to consider attending and thinking about as we continue forward with talking about the strategic prevention framework. Two cross-cutting principles, cultural competence and sustainability, are integral to each step of the SPF process. In addition, prevention planning using SPF should be dynamic and data-driven and reliant on community engagement. SPF is supported by a disparity impact statement consisting of the proposed number of individuals to be served during a specific time period and all identified under-resourced populations in the service area. The SPF process aims for equitable evidence-based practices, implementation to address substance use problems, and improve substance use outcomes and associated risk and protective factors. So community engagement, talked about so much, but it's critical. It's a critical factor in the scale up of evidence-based practices. Improvements in population health and equity. Therefore, it's important to identify and communicate its benefits and outcomes and provide guidance on best practices. Outcomes associated with community engagement occur at implementation, service, and individual levels, and this can include what is on the slide here. So coalition functioning, acceptability of evidence-based practices and or prevention strategies, adoption of evidence-based practices and or prevention strategies, feasibility, sustainability, and behavioral health functioning. Attributing outcomes to community engagement broadly or to specific community engagement activities is difficult. However, researchers have documented outcomes associated with community engagement at multiple levels. So now we're going to talk about the benefits here of community engagement within the prevention system. And where we're at with time, I think we're just going to keep going and end a little bit early. So if anyone needs to stretch, get a glass of water, take a break for a hot second, do it. But we're going to keep going with the presentation, okay? Hope y'all aren't falling asleep out there. All right, so we're going to start with community engagement. Starts with an organizing group, such as a coalition or community advisory board. The first step reported in reviewed community engagement efforts was gathering local stakeholders from diverse sectors in the community. Coalitions were by far the most common structure for accomplishing this organization. Most coalitions included stakeholders from 3 or more sectors, often including community members at large who are not paid staff of local organizations. Next up is community engagement typically involves a set of activities. So most studies engaged community members and stakeholders in multiple ways. Community engagement activities occurred at every stage of prevention planning and programming, so assessment, capacity building, planning, implementation, and evaluation. Many community engagement activities are ongoing, extending over several years, or for the duration of the substance use prevention intervention. Once a community engagement process is in place, it will ideally continue for the duration of a particular prevention intervention and preferably beyond that. Several studies involved coalitions that existed prior to the specific intervention of focus, and many described ongoing engagement of community stakeholders. Next is community engagement is an important component of many behavioral health programs. So research on these programs indicates positive outcomes associated with community-driven interventions. Although research designs in the existing research literature preclude linking outcomes to community engagement specifically, many communities have used community engagement to plan, implement, and evaluate evidence-based prevention interventions. Lastly is research-based evidence is currently not the best source material for practitioners seeking guidance on how to operationalize or translate community engagement principles into practice. So the available research literature lacks rich, practicable detail. This information is more likely to be found in gray literature, so what is not formally published, other products developed from practice-based data, or directly from communities doing the work. Want to touch base with people doing the work so we can get the firsthand information. Community engagement efforts often evolve over time. So for example, partnerships may change from having a single focus, such as opioid overdoses in a specific neighborhood, to addressing a range of social, economic, and environmental concerns affecting the community. Coalitions may also go through phases of development, confronting external factors within the community that affect coalition operation. This next slide is going to be our last video, and it focuses on an example of partnership with Nebraska Children and Families Foundation, partnering with community collaboratives and stakeholders. Okay, so it focuses this example of partnering. Again, it talks about those important protective factors as being buffers for children and families from certain risk factors, and also how important the community response is for the families that it serves. So I like this example as a way of how to partner and intervene in meaningful sort of ways. So anyone else can feel free to comment if anything stood out for that example of partnering, but we'll also move forward with other examples of partnering. So this one, This example comes from Washington State. The Healthcare Authority's Division of Behavioral Health and Recovery leverages state and federal funding to support high-need communities in implementing the Community Prevention and Wellness Initiative. So this is like termed as CPWI. So CPWI is a strategic, data-informed, research-based community coalition model aimed at bringing together key local stakeholders to provide the infrastructure and support necessary to successfully coordinate, assess, plan, and implement proven effective substance use prevention services. This coalition-based model is used to foster community ownership of prevention efforts and to increase the sustainability of proven effective prevention programming. The Community Prevention and Wellness Initiative is a community-focused approach to preventing substance abuse in Washington State. So it focuses on Washington's limited public resources within 82 high-need communities. Leaders in these communities are prepared to take on the challenges of preventing substance abuse in their towns and neighborhoods. In many cases, they are rising to the challenge despite the enormous odds of generational alcohol and other drug use that have left their communities awash in high rates of public assistance, crime, poor school performance, and poor public health. The Division of Behavioral Health and Recovery successfully collaborated with existing county government contractors and the Office of Superintendent of Public Instruction to redesign the state substance abuse prevention system into a targeted, community-based system. Community Prevention and Wellness Initiative leverages school and community prevention resources and targets them in the same communities throughout Washington State. The goals are to reduce underage substance use and misuse among young people, improve student performance, and reduce juvenile crime. An evaluation by Washington State University shows that the Community Prevention and Wellness Initiative is having positive outcomes, with 95% of programs implemented between July 2015 and June 2016 had positive results in delaying the first use of alcohol or other drugs, reducing use, decreasing risk factors, and/or increasing protective factors. Evaluation results also showed significant decreases. A note here too, I know I mentioned before about Florida, and this is just some feedback I got to include, just that there may be room. So Florida's record is good for youth substance use prevention, but there also may be room for expanding partners and programs for adult substance use, particularly with opioids and stimulants. So as they go through these different examples of partnerships, these can be some things that we take note of things that have worked well, or give us different ideas of, if we were to implement these different partnerships, how we might do it. It's part of sharing the information together. So next is evidence-based prevention and intervention support, which is centered around like a community coalition model, identifying the need for more coordinated and proactive support, and focuses on both delivery and sustainability. So the here and now and long term, how are we going to continue to do this? So since the mid-1990s, Pennsylvania has also supported a community coalition model planning process aimed at implementing evidence-based programs to prevent negative youth outcomes. However, after many years of broadly disseminating these programs, Pennsylvania recognized that communities needed more coordinated and proactive support. The state realized that beyond the adoption of effective prevention programs, communities also required support to ensure that they could both deliver the programs with high quality and sustain them beyond the initial seed funding the state provided. To help communities build this capacity, the Evidence-Based Prevention and Intervention Support Center, the EPSA Center, was funded in 2008 through a partnership between Pennsylvania State University's Prevention Resource Center, the state's Commission on Crime and Delinquency, and the Office of Mental Health and Substance Use Services, and the Office of Children, Youth, and Families. The EPSA Center serves as a state-level intermediary organization that provides proactive technical assistance and implementation support to communities that receive state funding to implement evidence-based prevention programs. Here are some of the results here from this partnering approach. So by providing the coordinated support communities need to successfully deliver evidence-based prevention programs across the state, Pennsylvania's behavioral health and juvenile justice systems are having significant impact. So in the state's fiscal year 2013 to 2014, the EPSA Center supported 70 evidence-based prevention programs that reached nearly 6,000 youth, which they estimated resulted in over 24 million return on investment for the state. All right, actually our last example of partnering. Also keep in mind the resource page on the PowerPoint is full of other resources and things to look at too after this training if you want any additional examples of partnering and resources. So we're next going to talk about what's referred to as PROSPER. So it's promoting school, community, university partnerships to enhance resilience. It's a practitioner-scientist partnership model that evolved out of a series of partnership-based prevention projects grounded in the land-grant university-based extension system in the elementary or secondary public school system. As a delivery system, rather than a substantive program, PROSPER attempts to foster implementation of evidence-based youth and family interventions, complete with ongoing needs assessment, monitoring of implementation quality and partnership functions, and evaluation of intervention outcomes. So we'll keep going with PROSPER. So the program is best characterized by a school, community, and university partnership. The partnership includes state-level university researchers and extension-based program directors. Also a prevention coordinator team, typically based in the cooperative extension system. Local community strategic teams consisting of a CES team leader, a representative from the public school, elementary or secondary school systems who serves as a co-leader, and representatives of local human service agencies and other relevant service providers and other community stakeholders such as youth and parents. As PROSPER teams develop, they involve other stakeholders who can positively influence program recruitment, program implementation, and sustainability, such as individuals from various church groups, parent groups, businesses, law enforcement agencies, and/or the media. The local strategic teams receive technical support from the university level and CES prevention coordinator team members who attend the local team meetings. So ongoing active partnership and participation here. This technical assistance is proactive, meaning contact is made with the local team members frequently, so either weekly or bi-weekly, in order to actively engage in collaborative problem solving. Once formed, the local team selects evidence-based universal level family-focused, and school-based programs to implement with middle school youth and their families in the local school district. All right, so now we're gonna talk about like the impacts of this partnership. So as a result, significantly lower rates of lifetime use of gateway drugs and illicit drugs for Prosper youth relative to controls, and these effects were stronger amongst youth who had already initiated use of gateway drugs at baseline. Prosper youth were significantly less likely than the controls to initiate use of marijuana, inhalants, methamphetamines, and ecstasy. Compared to the controls, Prosper youth had significantly lower rates of marijuana and inhalant use in the past year. So those are some of the results of that partnership. We talked a lot about different partnerships, and as promised, we do have resources here that you can kind of take a look at a later time. I'm just going to give a brief overview of the different resources that are there in case you're interested. So the Center for Communities That Care have different trainings and information about different programmings that are offered to get some ideas there. The next one, the core principles of community engagement, has a different approach with just different community engagement strategies, how to establish engagement goals, again, talking about the importance of trust, planning, and how to manage potential conflict with public issues. So those are all things that I think can be really helpful if we're trying to do the work and we're coming into different cross sections where it's not landing. An important thing to look at. The third one is EPSIS, which we talked about. So evidence-based prevention and intervention support. This one has a ton of great resources for technical assistance. So I'm looking at it now. There's even training videos, different guidelines with curriculums, model fidelity, how to track outcomes and evaluation, and communicating program impact and calculating return on investment. So this one, if nothing else, just feel like if you look at that and the different resources there, good to go. We also have SAMHSA's Strategic Prevention Framework, which has a lot of great information about those core categories from that imagery about how to make an assessment, capacity, planning, implementation, and evaluation. And then lastly, the community engagement resources. So this one has a ton of different links to different resources, whether it's like worksheets, articles, or print media or webinars that you can look into for additional information here. Like I'm literally looking and there's close to 20 pages of different resources that are categorized by the resource type. That could be really helpful, again, to look at further, or if you're taking back this information to the place you work and people want to know more, this is a good area to ensure that we're well informed in this training in our approaches to partnering. So lastly, the last thing I'll have you all kind of reflect on today, and please respond in the chat because we're just about to wrap up here. Answer one of these questions, or if you want to answer more than one, that's fine. But consider, as you're reflecting on the time we spent together today, what's the most important thing you learned today? Or maybe what's one thing you plan to implement? Or even talking about our strengths. What is something you're already doing well? So again, we're about to wrap up here, but please take a moment to respond in the chat box to one of these question prompts. Something you've learned or something you want to implement or something you're already doing well. And I'll read those as they come in here. So Kelly mentioned that information can be strong and the Prosper numbers were impressive, definitely. Elaine said ongoing collaboration with other agencies is crucial. Morgan plans to work on developing a partnership with a local community center. Awesome, great work. I think that's wonderful. Jermaine learned to be optimistic that things will improve. Yeah, we need that hope. We need that hope that keeps us moving forward. And to think about that slide I had with the sheep putting their heads together, like we can work together and have things get better from here. Because if we're optimistic and hopeful, that's going to translate in the work that we're doing. We also have Sandra, who said implement all department chairs to have a seat at the mental health table, right? Be able to listen and respect the opinions and experiences that are expressed when we are trying to work together and plan partnerships. Clarence said communication is basis and foundation of all relations. Yes, we need that trust. If we don't trust each other, we're trying to figure out what's the angle here, what's happening. We want to ensure that we're sharing that same purpose and working together intentionally for a shared goal or intention. Brittany said encourage more partnerships despite barriers and focus on protective factors. Yeah, I feel like in general, it's so easy to get caught up in the scaries, the risk factors. What about this and that and the other? But what are the protective factors at play, especially when we're talking about specific communities that we're working in or partnering with? What are those things that are the strengths that we can utilize to help make sustainable changes within that community? Strength, that sounds like, from Idris is having a lot of community collaborations currently with local police departments, school systems, and hospitals. Another example of something that's going well is promoting a wellness of protective factors outweighing risk factors. Wanda said, you provided inspiration to reach out to other community providers. I have 2 in mind that I'll reach out to this week. That's awesome. I'm so happy to hear that, and I hope that you're able to feel the benefits of that, whether it's a long-term partnership or just like this collaboration of acknowledgement of the work that you all are doing. And even if not right now, maybe in the future, there's that opportunity to partner with them. Marlene said partnership works best with shared purpose. We're currently partner with DJJ, DCF, schools, mental health liaison, and county coalitions. That's awesome. Abby's going to look over their evidence-based curriculum that you're using to review its effectiveness. Wonderful. We got supporting prevention policies and campaigns. Yeah, kind of making it more available and like in our face so that people can recognize the benefits of prevention. Prevention saves lives. I hope we can implement prevention programs at our agency through a partnership with the schools. That's great, Sydney. Christina said trust and collaboration is key. Alice said not to give up in the coordination struggles. Yeah, it can feel really muddy and murky at times, but it's so important. And partnering can be important to prevent now what could be an issue in the future, is what Krista said. Anika says, plan to follow up on collaboration meetings, including SAMHSA's strategic planning framework. Awesome. Rebecca, we want to be transparent with our need for funding and how much could potentially receive and the steps of how to get there. I'm going to read a few more and then we're going to wrap up. So Stanley said using the CADCA video showed to share at our next coalition meeting. It helps for the coalition members from each sector to understand how it works together, implementing the research, learning more resources in the community to help the people in need. Faith said, my greatest takeaway was to pay attention to your audience and make sure you have a welcoming and safe environment fit for your audience. Absolutely. Working with other partners and providers in the community. Yeah, this is all wonderful. I appreciate all of your feedback and openness to sharing. And I want to just take a second to thank you all for all that you do and for being receptive to this, right? Showing up to the training, participating in the chat, or even listening to it with minimal distractions. I think that's very reflective of who you all are as people. and part of your purpose, right? You wouldn't be here if it wasn't important to you. And I think you're crucial members within this community, whether you serve or the larger community, that has such an enormous impact and ability to help create these much needed changes long term. So thank you all for who you are and what you do, and I'm happy to be a resource as needed. Feel free to connect with me or reach out with questions or follow up on those resources. I want to also thank FATA, Florida Department of Children and Families, and to some VIPs that have helped me make sure this all comes together. Rebecca and Eric, thanks for being on here and being so helpful and supportive. And at this time, I'm going to turn it over to Rebecca for the wrap up.
Hey everyone, we've included Ashley's contact information so that you may contact her with any further questions that you may have. And Ashley, I hope you can see everything in the chat because, of course, as usual, you're getting high praises. It was a really great webinar. Thank you for all the information that you shared with us and all the time that you put into this today. And please note a couple of items of business before we conclude today's webinar. Please see the chat panel for a link to today's evaluation. Additionally, when I conclude today's webinar, your browser will take you to an evaluation on FATA's website. If you want to receive CE credits or statement of credit for this event, you must take the evaluation. You will be prompted to register or sign in to complete the evaluation. You can register as a visitor at no cost. For CEs to be reported to CE broker for Florida licensed healthcare practitioners, you must have provided an accurate Florida Department health license and prefix number when you registered for this event. After you register or sign in, you will be directed onward to the evaluation. You must use the same email address you used when you registered for today's webinar and what you have set up in your FATA profile, as this is the only way to connect your attendance and your profile. You will get a second opportunity to complete the evaluation through a follow-up email later today. The evaluation will close midnight, Monday, January 23rd, and we will issue CEs and statements of credit 30 business days after the evaluation closes. We do not email statements of credit. Instead, after we verify attendance and completion of the evaluation, a statement of credit will be generated as a journal entry within your profile 30 business days after the evaluation closes. Thank you all for participating in today's webinar. We'd also like to recognize and thank the Florida Department of Children and Families Office of Substance Abuse and Mental Health for funding today's education. Have a great day.